for healthcare in Gauteng and healthcare around the country, if I'm honest. It's a state-of-the-art private hospital. It's set to open up here in Johannesburg. It's known as the Johannesburg Surgical Hospital, going to be home to some of the country's top doctors, specialists and surgeons. But listen to this. This is what's so interesting. 36 of the country's top medical professionals have put their own money into this facility. Well, let's bring in Professor Alex van den Heever from the Progressive Health Forum. Always very kind to make time for me so early on a Monday morning. Prof, good to have you with us. And I just want to make sure that we all understand where we are talking about. For those who haven't quite figured out where it is in Joburg, this is that new construction along Beyers-Naudé near Cresta Shopping Centre, isn't it?
That's correct. So it's very, very central from a sort of a Johannesburg perspective, right, sort of smack in the middle of the sort of urban environment.
And it's near the eye hospital. It's near some other specialists along Beyers-Naudé, so it's perfectly situated. Let's talk about why this was necessary in your mind, because I find the fact that it's privately funded fascinating. Doctors taking their own money and going, you know what, we know what needs to be done. Let's put our money down. Let's put our money where our mouths are and get this going. Why go the private funding in your mind, do you think?
Well, actually, this has been the model that grew the South African private hospital system since the sort of early 1980s. A lot of the hospitals were doctor-owned and doctor-invested. What we've seen is that there's corporate groups who've subsequently merged these hospitals under a sort of corporate umbrella. But a lot of the hospitals were originally begun through doctor-based investments. So this is not an unusual scenario. This is pretty much how it happens within the private sector. We do see that the major corporate groups can invest themselves in creating new facilities, but these become independent hospitals that are separate from the main corporate groups.
And what sort of gap is this going to fill? Let's talk perhaps from before we get to the surgical side, etc. What sort of gap in the market is this trying to fill? What need is this fulfilling, do you think?
Well, the area of surgery is not, and there is no lack of investment in this particular area in the private sector. So there's been quite a lot of analysis from the Health Market Inquiry and various other studies of the private sector. It's got a very substantial number of beds and what one would call tertiary beds and specialized beds. So there's no shortage of beds and specialized equipment. The private sector is, in fact, in many instances in South Africa, it is better provisioned than many countries in Europe. So this is not unusual from that perspective. I think that what this will be is probably a grouping of surgeons who will kind of work together in a sort of specialized facility. But I think that we're not necessarily seeing a major gap in supply of private beds, private equipment, and top-of-the-range equipment in South Africa. But we do tend to be sort of at the top end of absorbing new technology and equipment in the private sector side, by way of contrast to the public sector.
I'm just thinking, again, just geographically where it is, Prof. I know the Cresta Beyers-Naudé area relatively well. So for those who don't know it that well, there's, for example, eye specialists in the area. There's what I think is known as a step-down clinic. I think it might be right next door, actually, where after surgery, if you're in a hospital, you've gone through the post-surgery care, post-op care there, but you need rehabilitative physical care. You go down to a step-down clinic. Does this private clinic in any way assist some of our bigger hospitals? I'm thinking of, in that area, Wilgeheerville, Mill Park. I feel like I'm missing one. Olivedale, for example. Could that, Flora, thank you, my TD just reminding me of Flora Clinic not too far from there. Does this in any way assist them in any way, shape or form?
Well, not necessarily. I think these facilities tend to operate in competition with a lot of the other facilities.
Oh, okay.
So they will operate as a referral center for such surgery. So a lot of the relationships will be via specialists who would be referring to that hospital. So a lot depends on the networks that are coming into that hospital. That's one of the reasons why the investors can be relatively confident that they'll get a return on their investment, is they're also putting together their established networks, referral networks. And so, yeah, the private sector facilities don't necessarily cooperate expressly in that sort of way. But the question really is what will be the impact on referrals to other facilities. But that's basically for the market to sort out.
And Prof, I suspect you and I have spoken many times over the years. I think you knew I was going to throw a curveball in somewhere. There's talk of the NHI. What's going to happen with a private clinic like this and this introduction of the NHI, whenever that might be, in whatever form it takes? Where does a clinic like this, a specialized clinic like this, fit into the framework of an NHI, or just does it not, and it shouldn't be fitting into NHI? What's your view?
Well, I think that the issue with the NHI is that it is there's questions about its feasibility, technical feasibility, fiscal feasibility, that have never been done. So there's what people want it to do, and there's what it will actually achieve at the end of the day. I think that this investment basically comes within that space where it says, well, we don't really think there's going to be any impact on private provision, private coverage as such, and so it's kind of relatively safe. But the NHI proposal was supposedly that the services and the use of this facility would be by way of contract with the National Health Insurance Fund. But that's not really feasible, and I can't really see it happening, which is, I think, why this is occurring. People are basically saying, well, you know, a bill will be passed, but the status quo will remain.
Yeah, I was about to say, it's that status quo that we've spoken about over the years with yourself and other experts as well. Prof, as I say goodbye to you then, I'm not sure if maybe you're the right person to ask. So incredible new structure, state-of-the-art, looks very fancy. What sort of specialists are going to be there? What kind of surgeries are taking place? Are we talking cancer treatment? Are we talking ophthalmology? If you do know, just off the top of your head, if someone's watching this now going, great, but what are they actually going to do there? Do you know some of the specialties?
No, I don't know the specific surgical specialties, but it looks like it will be a group of surgical specialists and using sort of top-of-the-range, sort of robotic-type surgical approaches. And that's really their approach. That type of surgery is available in other private facilities and public facilities in many instances, but I think that what they're doing is concentrating all of that in a single facility. So I'm not sure all the surgical specialists that have kind of grouped together to be part of this, but I think that what they would have done is try to get as wide a range as possible of the key surgical specialties to group together around this facility.